If you've been told you need aortic valve surgery, the first thing that most people imagine is a large scar, a broken breastbone, and months of recovery. My name is Inder Birdi. I'm a consultant cardiac surgeon here at the Keyhole Heart Clinic, and I want to tell you now that that is no longer the only option for you. Your aortic valve is a door in your heart that opens and closes with every single heartbeat, letting blood flow out to the rest of your body. When that door becomes stiff or starts leaking, for example, your heart has to work much harder, and over time that causes symptoms such as breathlessness, fatigue, chest tightness or dizziness, and it damages the heart and will shorten your life. Now, left untreated, severe aortic valve disease is very serious, and the outlook deteriorates quickly once symptoms start to appear. Now, the really good news is that it's completely fixable, and the way we fix it has dramatically changed. Traditional open heart surgery involves splitting the breastbone and then wiring it back together after and waiting 12 weeks for that breastbone to heal. Now, it's a big operation and the recovery reflects that. At the Keyhole Heart Clinic, we've been taking a completely different approach that's evidence-based. Through a small incision, just a few centimeters between the ribs, on the right-hand side of the chest, we remove the faulty valve and replace it with a new one. We don't change anything we're doing inside, we just change the way we do it. No broken bones, no large scars, and the same excellent result. Now, most patients are home within 3 to 5 days after surgery. The wound heals in 7 to 10 days, and you're back to normal life within 3 to 4 weeks, not 3 to 4 months. The great majority of patients who need aortic valve replacement are very suitable for the keyhole approach, and it's also well suited to older patients and those who've had previous heart surgery, where the gentle approach on the body matters the most. If you've been told elsewhere that keyhole heart surgery isn't an option for you, I would really encourage you to seek a second opinion. We've helped many patients who've initially been turned away from the keyhole heart surgery approach only to find out that they were very suitable. We've performed over 2,000 minimally invasive heart procedures on the background of nearly 8,000 heart operations in my career to date. My team has been assembled specifically for this type of surgery, operating here at Cromwell Hospital in London. I think one of the UK's leading private hospitals with intensive care covered 24/7. And the evidence supports the treatment. NICE guidance suggests that patients being referred to specialist centres like ours if keyhole expertise isn't available locally. So if you received a diagnosis of aortic valve disease and you need an aortic valve replacement, or you simply want to understand your options, the next step is a consultation with one of the team here at the Keyhole Heart Clinic, or indeed with me. We can perform those consultations face-to-face or online to suit you. We'll aim to have your surgery scheduled very, very quickly, but before we even consider your surgery, we'll make sure you understand your condition, why you need heart surgery, what that is going to mean for you in terms of your long-term outcome, and whether or not keyhole heart surgery is safe for you. You deserve to know all of your options. If you want to know more, fill in the form on the page that you visited or give us a call and one of our experts will discuss the options with you and how to move this forward with us. Bye for now.